Hey folks, this is Beth Wright, and I'm providing you a podcast for Unit 1, NUR 236, Chapter 18. So I think you had some of this back in maybe Pharmacology 137 possibly, but it's real important to go back and review this again because you will be tested on it. And it is part of the elimination unit where we're talking about UTIs, urinary tract infections, and that's a common thing that we see with patients because of the seriousness of it. If gone untreated, can end up in urosepsis, or the patient can become septic, and pyelonephritis can occur. So very important to know about the medications that are used to treat this. So I have your objectives for this unit, and again, remember that all test questions are coming from an objective and an exemplar, so really important to know those objectives. We got the mechanism of action, indications for use, principles of therapy, nursing process. And think about that nursing process: assessment, nursing diagnosis or analysis, the planning, which is your goals, and the interventions and evaluation. Also, you got to know the labs or pertinent data prior to administering these medications, including the contraindications, the lab results, allergies, and any potential interaction. And that can include drug-drug interaction, drug-food interaction, so real important to know those. And then, of course, applying that nursing care, that nursing process, and providing safe and effective medication administration. Teaching is always going to be important for all drugs that we administer. That is one of our main things that we do, so much teaching, and it's so very important to keep the patient from having injury. And then, of course, evaluating the client's response, both with therapeutic effects and adverse effects, side effects. And then, last but not least, providing measures for prevention or treatment for adverse effects. So I have you a pictogram of a person with a UTI, and you can see the lady is crossing her legs there because of that urgency, frequency, dysuria that occurs. Patients can have hematuria with this or not. Fever can occur, and for older adults we a lot of times see confusion. They may not have that dysuria, that frequency, urgency feeling, but they may appear, or present with confusion. So, very important to assess the urine of older adults who are presenting with confusion. That, is a difference from what they had been doing. Also, odor of the urine can be a distinct sign of an infection. And again, the cystitis is a bladder infection. Pyelonephritis is where it's in the kidneys. And of course, if you think about that whole mechanism of how the kidneys work, if it's a pyelonephritis, then we're, heading toward being septic with the infection from the kidneys going into the bloodstream. And folks can die from this, so we want to get on top of that as soon as possible. And you can see the nursing goals there for both of those. So, going to spend a lot of time on this particular slide. and you'll have it in your notes as well. So the medications that we're talking about, starting off with your sulfasalazole. The mechanism here is that it is a bacteriostatic medication, and just thinking about it does metabolize in the liver and excrete via the kidneys. So anytime you see that with a medication, we have to be concerned about folks with possible liver and kidney problems. Indication for use, it's always recommended that a culture and sensitivity is done so that we make sure we have the right drug for the right bug. Another indication is the trachoma, which is a bacterial infection of the eye. And the Juvisc there is also listed, I believe, as one of your indications, or yeah, down at the bottom there of that particular column, and that's a diagnosis that you see with HIV patients, pneumocystic coronary, PCP. That's your HIV infections there. It's also used with bronchitis. It also can be used for strep infections or staph infections such as cellulitis, meningitis. So several different uses there. Otitis media, ear infections. This is a widely used drug, and so that's why another reason why we need to know it. The principles of therapy there for special populations, they should not be used with children younger than 2 months of age because it displaces the bilirubin into the bloodstream, and it can cause a connectorus. Connectorus is a bilirubin-induced brain dysfunction. And bilirubin, we need a little bit in the blood, but not a whole lot because it is neurotoxic, and it can become elevated in the blood, and when that happens, it's referred to as hyperbilirubinemia. And what happens with that is it can accumulate in the gray matter of the central nervous system and cause irreversible neurological damage. So we need to be very cautious, or not use for children 2 months of age, younger than 2 months of age. Older adults, we need to definitely assess that renal status, and it needs to be avoided in liver and renal impairments. So what does that mean? We need to assess those areas for any kind of impairment, including the lab work. So a nursing process for individuals receiving this medication, of course, we need to assess the indication. Got to look at that urinalysis for the WBCs and a urine CNS, as culture and sensitivity. Got to look for those signs and symptoms of a UTI, which is that dysuria, the frequency burning, that kind of thing. Definitely want to look for allergies on this medicine because it is a sulfa drug, and lots of folks are allergic to sulfa drugs. Also, allergies to salicylates, which are like aspirin products, or medicines used to treat group A beta strep. So we got to, again, look for those allergies. And it's also contraindicated in conditions such as the porphyria. That is I didn't know what it was initially, and I had to look it up. But it's a kind of a rare type of thing. But it is a group of disorders that results from the buildup of a natural chemical that produces porphyrin in the body, and porphyrins are essential for the function of hemoglobins. Um, High levels of porphyrins can cause issues with the nervous system, the skin, and other organs. The signs and symptoms can vary. It's usually inherited, um, and some types of porphyria, environmental factors may trigger the development of the systems. And I got that information from Medline Plus. Also, the G6PD deficiency, that is a glucose 6 phosphate dehydrogenase deficiency, and that's a genetic disorder that usually occurs in males. It's a premature breakdown of red blood cells that causes hemolysis. So the patient may present with like a hemolytic anemia when this occurs affecting their red blood cells. We have to look about drug-drug interactions with this as well, because this particular drug it uses that cytochrome P450 enzyme in the liver, and lots of other medications use that as well, and so it's going to compete with those drugs, and it may not win the competition, so to speak, and that would cause an increase in the drug in the blood, causing more side effects. Drugs that increase this particular medication can be alkalizing agents, salicylates, NSAIDs, oral anticoagulants, phenytoins, which is your Dilantin, medicine for seizures, methotrexate, which is a cancer drug or a drug that treats autoimmune disorders. Those can also cause increase of this drug in the serum or in the blood. Also, warfarin can cause an increase in blood clotting when given it with this drug. With other sulfonylureas can cause an increase in hypoglycemic reaction, so we need to watch about drug-drug interactions and make sure their blood sugar is okay. Talks about also with IV dilution of D5W only, so that's something specific. If a lot of times it surprises you with certain medications. You think, well, surely everything can work with normal saline, but that's not the case. This one is specific to D5W. We got to monitor for allergic reactions because again, a lot of patients are allergic to sulfa drugs, and so we got to be watching for that. Need to teach a patient to drink 1.5 to 3 liters of fluid today, unless it's contraindicated, per day. Contraceptive effectiveness is decreased, so we need to teach, women of childbearing age to use other protection while on this medication. I've heard a lot of women become pregnant because they took this medication and their birth control didn't work. We need to teach the patient to avoid sunlight because they can blister being out in the sun and trying to recover from a UTI, and using this medication. need to avoid over-the-counter drugs and talk to the physician about it. If they're diabetic, monitor those blood sugars. Monitor for super infections. This can cause a rip-roaring yeast infection, so we got to teach them signs and symptoms about that as well. And teach to empty the bladder frequently and proper cleaning after urination. Your nitrofurantoin is your next drug, and these are urinary antiseptics and sometimes can be used. They're used for UTIs, but they can also be used for prophylaxis. Sometimes folks are placed on this who are prevalent to UTIs. The principles of therapy: children older than 12 can use this medication, and the macrodantin and the macrobid, children 1 month or older, are your age-specific things. Contraindication: don't use late in pregnancy, any renal impaired, and then adverse effects. It can affect cardiac changes, your ST segment and T-wave changes, and bundle branch block, not branch. So, if that is the case, don't you think we might need a baseline EKG? I think that would be important to see to make sure we don't have any of that going on prior to giving this medication. Your CNS changes, fever, malaise, depression, headache, lethargy, vertigo, and pseudotumor cerebri. What that is that occurs when pressure inside the skull increases for no obvious reason. It mimics like a brain tumor, and that's your pseudo. Pseudo means false. But there's no brain tumor present. And it can occur in children and adults, but it tends to occur most often in obese women of childbearing age for some reason. And there's no underlying cause for it. It's and sometimes when they do a CT or whatever to determine that there's no brain tumor for the cause, they may refer to it as idiopathic intracranial hypertension. So, of course, the medicine can be reduced or discontinued in that case. Also need to assess for hyperphosphatemia, pulmonary insufficiency, and blood dyscrasis, which basically means your blood cells are getting out of whack. The phenazopyridine is your next one, and that is a urinary analgesic and works on urinary mucosa, and it is metabolized in the liver. So again, when we see that, we know we need to be watching about liver function with that. And it's used for UTI, trauma of that urinary genital area, cystoscopic exams, and sometimes catheter insertion. Principles of therapy: must be given children 6 years and older, and adults should avoid the use because of renal, pulmonary, and hepatic toxicity. We need to assess for contraindications, liver, renal impairment, and teach about administering with food. We need to be sure to teach about that the urine will turn red, orange, and it will stain. So we need to teach the patients about that it can definitely cause, some staining of the commode seat, that kind of thing, and it can definitely cause fear of the patient thinking, oh my God, what's going on? So we need to definitely teach about this. Now, this has a black box warning, and it about liver function. So the patient needs to report any kind of jaundice. Also report sore throat because it can mess with the blood cells and any kind of bruising or that kind of thing. Now, on this particular slide, I cannot see the lower medication there. So I will have this in your notes, so you need to be sure about reading the notes on the trimethoprim medication as well. I have you a pictogram on the phenazopyridine, and so this is a common medication that's used for helping with the dysuria, the painful urination. So again, just these are there for your help, and I hope you enjoy them.